been so impressed by the way in which the staff have engaged with the idea about how they can work across the organisation to improve patient safety.
It's very important to keep patients at the right temperature, which the bare pause maintains, because it helps the patient's wound heal much quicker, and the patient also is able to recover much quicker as well. Some patients, they do enjoy it, they find it very warm and very comfortable. If they find that they get too warm, then it can be turned back down to cooler. But we do check the observations to make sure that the temperature has become 36 plus.
I think the main way in which the 1,000 Lives campaign has empowered staff is enable them to take evidence-based practice and implement it at a local level. For example, the track and trigger form, which used an established technology, if you like, the modified early warning system, adapted it to Powys patients and their particular characteristics, developed it on a small ward, and was then able to roll it out throughout Powys.
It helps the patient because nurses are able to see very quickly whether they're deteriorating, and sometimes it might be the slightest little change in blood pressure or respirations, and then a nurse can quickly get a doctor to review the patient. Track and trigger has the potential to save patients' lives because it means that their deteriorations in their condition are spotted quickly, and so action can be taken quickly.
The surgical checklist is so important that it enables us to actually check that we've got the correct patient and that they're actually having the correct procedure done. The patient is asked a series of questions on the ward, then they're brought down to the anaesthetic room. We're in front of the anaesthetist and we all do it verbally. We ask another series of questions, but these also encompass whether they've got a difficult airway, whether there's any bleeding likely to be anticipated, have we got all the equipment available. And these are asked loud in front of the patient, and the patient answers his sections of the questions himself or herself. If they're asleep, everybody checks the checklist again, and with the patient we check the name band on the patient, we check that the site is marked correctly again, and all staff have to introduce themselves just so everybody's aware of everybody's jobs titles.
It's been shown that if we clip the patients now to remove the hair in the anaesthetic room prior to the surgical incision, it prevents surgical site infections. Whereas if it was done before, the hair could grow back, or the patients could actually cause abrasion on the skin, leaving it open for colonisation of bacteria.
Medicines reconciliation means for the patient that we have an accurate medication history. We haven't got medication that was out of date. We haven't got perhaps a husband or wife's medication inaccurately recorded. We haven't missed any medication. So the patient is taking everything that they are supposed to be taking, and it also then means that we don't make any inappropriate dose changes or drug changes. Medicines reconciliation saves lives.
Hand hygiene is very important because it stops the spread of MRSA and other sort of bugs on the ward from going to one patient to another.
We've engaged patients and visitors by having open days. We've got posters up everywhere, and each bedside and at the opening to the ward there's gel to ensure that patients are aware of hand hygiene. It's very important that we actually educate all the staff, that it becomes a culture that as soon as they've had anything to do with a patient, that they wash their hands thoroughly.